Could your stretching routine be doing more harm than good? If you're like a majority of people, the answer is yes. People often stretch to prevent or relieve an injury. Unfortunately, your technique or choice of stretches can actually cause the very thing you're trying to prevent. I'm Dr. Leevi, your local Maroochydore Chiropractor from Wisers Road Chiropractic. And in this video, I'll show you the 5 most common lower back stretches that are doing more damage than good and what you should do instead. The lower back is probably the most common area where good stretching intentions can go horribly wrong. And this happens for a few key reasons. In a nutshell, repeated or sustained flexion of the lower back is not good. Flexion of the lower back is the movement of bending at the hips and bringing the chest to the tops of your thighs. To understand why this is bad for the lower back, can I share with you a few things most people don't know about lower back health? Your spine has some normal weight-bearing curves. If you look at the spine from the side, you will see 3 curves. A forward curve in the neck and lower back, and a reverse curve in the mid-back. Preserving the natural curve, or what can also be called the neutral position of the lower back, is important to preventing injury in that area. Why is flexing the lower back bad? A majority of spine injuries happen when the lower back is in some sort of flexion, when the trunk comes closer to the legs, such as bending over to pick something off the ground. Between the bones of the spine are the intervertebral discs. These act like shock absorbers for your spine. The outside of the disc is like a fibrous material, while the inside is a gel-like substance. A flexion posture in the lower back puts a tremendous amount of pressure on the intervertebral discs. Over time, this repeated flexion can damage the outer fibrous layers of the disc, and the pressure pushes the gel substance into these weakened layers. Like a jam donut, if you squeeze one end, you push all the jam to the other end, and it can burst. This is exactly what happens in the intervertebral discs of the back. This can lead to common scenarios such as disc bulges and herniations. With this in mind, when we are doing our stretches, we should do our best to preserve the natural curve of the lower back and keep the spine in a neutral position. A note about the stretches. Often people cite, "it feels good," for a reason to continue doing stretches that are detrimental to their spinal health. I often say to patients, just like picking a scab, what feels good in the short term is actually doing damage in the long term. The short-term relief that these people get from these stretches is far outweighed by the long-term negative consequences. And once they stop aggravating their backs, the urge they feel to stretch or release it will soon disappear. Let's begin our top 5 worst lower back stretches. Number 1, knees up. This is one of the most popular stretches for the lower back, and harmfully recommended to do first thing in the morning, which I'll discuss more about later. You see, in this position, laying on your back, bending the legs up and tucking them into your chest, you're causing so much flexion in the lower back. You're taking the lower back in the exact opposite direction of its neutral curve, hence why it's not a good thing to do. A much safer alternative is the cat-camel. This is a great exercise and good to incorporate into your daily routine. It is a safe and effective way to get movement into the spine without stressing the spine with too much load. Think of it more as a motion exercise instead of trying to stretch and push the limits of the 2 positions. Start on your hands and knees with hands directly below shoulders and knees directly below hips. As you breathe in, gently look up and drop your belly to the floor like you're arching your back. As you breathe in, gently look up and let your belly drop to the floor, accentuating the natural curve in the lower back. As you breathe out, tuck your chin to your chest and arch your back up, pushing away and making space between your shoulder blades. You can repeat this 8 to 10 times. Number 2 bad stretch for the lower back is the standing hamstring stretch. Probably one of the most common stretches of all, the good old standing bend forward and touch your toes. As mentioned before, this is the exact mechanism that you want to avoid in the spine to prevent injury. Once again, we see we've lost that normal natural curve of the spine. A much safer alternative is a lying hamstring stretch. This allows you to still stretch the hamstrings while preserving the lower back. Simply lay on your back, bend one leg, straighten the other, use your hand behind the knee or the hamstring to help stretch that straightened leg. Number 3, the spinal twist. A popular stretch done to get a release in the lower back. Ultimately, this stretch will do more harm than good and is probably responsible for more people needing an emergency trip to the chiropractor than any other stretch. The fact is that the lumbar spine, the lower back, is not made for rotational movements. These twisting movements can lead to a lot of torsional stress and damage to the outer fibers of the disc. A much safer alternative is thoracic spine rotation, mid-back rotation. Although you end up in a similar position, the spinal areas that you twist to get there are a much safer option. The thoracic or mid-back spine is supposed to rotate, and for many of us, due to our sedentary jobs, it can get very tight and locked up. This is a great stretch or motion exercise to get some much needed life back into that area. Lie on your side with both knees bent. This helps to lock the pelvis and lower back in place. Have your arms stretched out in front of you, palms touching. Take a breath in, and as you breathe out, open up your top arm. Breathe in and bring your palms back together. And breathe out and repeat. You can repeat this 8 to 10 times, then swap sides, lay on the other side and do the same movement. Number 4, seated piriformis or glute stretch. The piriformis is a muscle in the glute region, starting on the tailbone, which is the sacrum, and attaching to the top of the hip, the greater trochanter of the femur. You can see it in this diagram, going from the tailbone to the top of the hip, the piriformis. This region can get tight if you are experiencing any lower back or pelvic pain, and any pain into the buttock or even down the leg is in the classic sciatica presentation. In some cases, the piriformis can contribute to irritation of the sciatic nerve. Therefore, it is commonly recommended to stretch it out. Unfortunately, the common ways to stretch it put the lower back in a compromised position. As you see above, once again, we're making that C shape in that lower back. A much safer alternative is the lying piriformis stretch. Lying on your back, preserving a neutral spine. To stretch your right piriformis, place your right ankle across your left thigh. Reach both hands to grasp the back of your left leg. Pulling with your hands will pull your left leg towards you, which will pull your right shin closer and increase the stretch on the right leg. You should feel this in the right back of the hip. Number 5, stretches in the morning. Not so much a specific stretch as a very important tip. Ever heard the saying that you're taller in the morning? Well, it's true. First thing in the morning, the discs of our back have increased in size by retaining more fluid because they haven't been under the pressure of our body. When the disc is more fluid filled in the morning and is stressed with bending it, it will exert a lot more pressure on the outside of the disc. Remember the jam donut analogy we used earlier. This increase in pressure can really cause a lot of damage. Research has shown disc bending stresses are increased by 300% and ligaments by 80% in the morning. What should you do instead? The simple act of moving around gently decreases the built-up fluid in the disc. Being mindful of early morning bending activities is very important. After watching this video, you shouldn't really be doing any forward bending type stretches anyways. If you do need to do some forward bending activities in the morning, make sure you have been up and about for at least 1 hour. Thanks for watching. If you know someone who could benefit from this video, please forward it on to them. If you're in or near the Maroochydore area and suffering with back pain and want to get to the cause of it, then give the clinic a call. Wisers Road Chiropractic, 6A, 84 Wisers Road, Maroochydore, 07 5443 4545.